And welcome on into this Wednesday afternoon here on the Talk to Me Network, home of Helping Seniors of Brevard. And we're going to get the show underway right now as we introduce the host of Helping Seniors of Brevard and the executive director. Here is Kerry Fink. Hi, Kerry.
Hey, John Harper. It's always a pleasure to gather around the radio Wednesdays lunchtime right here on 90.3 FM, WEJF. And also welcome to the listeners who are joining us online at WEJF.net. And also a shout out to everybody who picks up this broadcast later because the podcast is becoming more and more popular week by week. Folks are finding us on everything from Apple iTunes to iHeartRadio to Spotify, or even you can go, hey, Alexa, play Helping Seniors Radio. We're even on the Facebook podcast. So just doing everything we can technologically to make sure people get access to the information on the Helping Seniors radio program. As you know, our president and founder, Joe Steckler, established Helping Seniors of Brevard in 2011. And so we're now moving ahead into our 12th year of service of operating the county senior information helpline and then doing our best to get information out in the hands of seniors that's going to help them. And one of the folks that I'm so pleased to welcome to the show today, longtime friend of Helping Seniors, it's the guy who got Joe started in TV, very much like John Harper got Joe Steckler started in radio, but it's Dr. Lee Sheldon. How are you today?
I'm okay, Kerry. Great to talk with you again.
Yeah, it's a pleasure. You know, here's a funny story. We were just going through, since Joe started Helping Seniors, we've done something like 270 different television shows. We've been on the radio weekly since the network started, but we've now actually done 270 shows. And I just wanted to say this, Dr. Sheldon, we archive those shows. So they're all available on our Helping Seniors YouTube page. You can find them on the Facebook Watch page, which is what they call that little video portion of your Facebook app. And then we, of course, make them available on the HelpingSeniorsOfBrevard.org website. And just more on a lark than anything else, you were actually Joe's very first guest when we did the TV show all the way back, and I was looking, this was October 2012 when Joe established got the TV part rolling, and there you were, and you were talking about several topics that were so important to dentistry and to our mouth health, is really what it came down to. And I kept thinking to myself, it's like, as I was actually stop in and start watching those shows are still valid, Dr. Sheldon. I mean, they're still on the money.
Well, I'm thinking about that. The original shows we did were at what was called at that time BCC, Brevard Community College, and that was done at the Cocoa campus. And I think the other thing came to mind right away, Kerry, had nothing to do with the validity of those shows. It had more to do with you can trace my age based on the hairline. So take a look at 2012. Take a look at today. Although today we're on radio, but we did a TV show. Well, we haven't done TV probably in a couple of years, have we?
Yeah. So we're back to doing that. But I was going to tell you, the very first show you did in the Helping Seniors world was you just published the book, The Ultimate Mouth Manual.
That's right. Now we're in this third edition, and I'm trying to get time to do the fourth edition, but so far I'm not doing very well at it.
Well, I was going to tell you, I remember you were kind enough to give us a copy of that, an autographed copy, no less. And I remember reading through it, and it was such a revelation about these things because most of us, first of all, we just dread going to the dentist generally because we figure it's going to involve pain and expense. And then here you come, the first time I meet you, I mean, you've been friends and worked together with Joe for years, but you say, hey, I just published this thing called The Ultimate Mouth Manual. And Tammy and I took it home. We read it kind of cover to cover, and it was great information. And I remember you came out with the second edition and a third edition, so you've really kept it up to date as we've gone along, too.
Yeah, and it was important that we do that, and the procedures are becoming more streamlined. Some of the things we're doing right now at Solid Bite are different from what we've done, what we were even doing 6 months ago, where there's more technological increases, which reduce the amount of time in the dental chair. I don't know about you, but I think most people want to reduce the amount of time in dental chair when we're doing some of those complex procedures. And so, I mean, it's just, it's been 7 years since I've done surgery on any regular basis at all, and it's just changed tremendously. And so that would be the reason for the new edition of the Ultimate Mouth Manual, so that we can cover some of those things. But in the meantime, I've done a couple of videos, and you can get to our videos at our website at solidbite.com, and you can see some of the videos that we've designed with professional graphic artists in order to be able to show people more about what they can do to preserve, in this case, to preserve bone and or minimize bone grafting. And so there are a lot of advances, just so there's more to look at, so that you can have a better appreciation for what your dentist may be recommending to you, and perhaps some alternatives that you can consider as well. It's always best to be educated before you come in, and that was the reason for the Ultimate Mouth Manual to begin with. There's an awful lot that you can't see in the mouth. If you have plastic surgery done, you can see what's going on. You can't see behind your lips. And the reason we wrote the Ultimate Mouth Manual is so you could have a better view as to what we're seeing, why we may recommend or perhaps not recommend what could be done, and become a better consumer as a result.
Yeah, I was, and I was looking back through the list of the TV programs because, and I was, again, what I say, maybe some of the procedures have been updated or even maybe more streamlined. But I mean, there was some great shows in the early day, and literally, I think it was the very first recording session that Joe had established when he was getting the whole TV side of helping seniors rolling. You did a show on dental implants. You, together with Nancy Deerdorf, did a show on weight control. I mean, I was fascinated with the topics and the range of topics that you and Joe covered together on these early days. There was another program title that I thought was interesting. You did a whole show together with Joe about headaches, and it was interesting because you were explaining. And again, listener, if you're listening to us on the radio, these shows are available to you today. You just literally go to helpingseniorsofbrevard.org and type in the search bar and say headaches, and you'll see this show, because I think your point that you were making in that particular show was you were talking about how sometimes headaches can be coming from, what did you call it, the TMJ joint or something like that?
TMJ, yeah, it's the joint between the lower jaw and the skull, and all of the muscles that are associated with that. So, and we had a good time doing that. But I'll tell you, you bring up Nancy. Nancy, of course, Nancy and I worked together on the board of Helping Seniors of Brevard when it first got started, and now Nancy's back, and now Nancy's back as what? Wonderful. The educational director?
Well, her official title is operations manager, but lately she's been really cottoning to the idea of calling herself a senior care navigator, because that's really what she ends up doing a large part of the day. She supervises all the calls that come in on our Helping Seniors info line, which is 321-473-7770. Let me say that again. Give you a minute to grab a pen and a paper. The phone number, the Helping Seniors info line, is 321-473-7770. It's a free call, and what we do is connect seniors and the people who love and care for seniors to resources they may not know that exists out there. And so she perceives herself as one of the most important things she does day in, day out, is talk to these seniors and their families and try to get them navigated in the right direction. And people sometimes go, is that just like if I call a referral line? And says, no, it's way more than that, because oftentimes she has to, it's multiple calls. We gave you a number. Did you talk to them? Was that helpful? Do we need to try another avenue? That's all the service that we do as a Florida nonprofit, as you very well know, Dr. Sheldon.
It's true. And let's talk a little bit more about Nancy. Nancy is a nurse, and
Yes.
Nancy ran a major institution in our area. So
Yes.
you're getting some major seniors institution in our area. So if you think you're getting just a call screener or a referral line, no, you're getting a top quality individual. So yeah, call Nancy. Nancy is just a resource, a tremendous resource. And I saw Nancy for the first time in years at Joe and his wife Terry's anniversary party.
Right.
And Nancy and I may do a show together, Kerry. So
I hope so. I hope so.
If we arrange that, because we had a good time together.
We should have you guys do. We should have you two do TV together. Because again, like I said, there were so many excellent topics, and I wanted to say this before we get into our topic of today. Which, by the way, listener, we're going to talk about, as we're talking about dental problems, we're going to talk about the formula to dental success. That is actually going to be the topic. But Dr. Sheldon, I was going to say, just looking back through these, you were doing shows on sleep apnea, which was interesting because you wouldn't necessarily think, well, if I think about dental, I'm thinking about things to do with my mouth, my teeth, but I wouldn't have put that in there. And you also did a show on cancer and dental care, which was interesting to me too, because from the standpoint that you had some very specific recommendations for people going through different treatments for cancer care and how that would need to be reflected in their dental care.
Yeah, it's true. As a matter of fact, I just saw the person that we developed our protocols with, Dr. Silas Charles, who's retired, but he was in charge of, I think it's Cancer Care Centers of Brevard. That his organization. He's since retired from that, but that was his baby. And when I first got here in 1980, Silas had just gotten here the year before, and I contacted him and I said, do you have any cancer protocol for those people who have oral cancer? And he said, I've been looking for somebody who would help me with that. There was nobody who could help me with that. And so he and I developed a strong relationship right away in 1980 to be able to help people be more comfortable during their radiation therapy, during cancer care. That's developed into a chemotherapy, or at least we're recommending and talking about a chemotherapy protocol as well, because there are some chemotherapies that may put the mouth at risk as well. And so if teeth need to be treated, infections need to be treated in the mouth, teeth need to be extracted, we often used to think of that in terms of extracting teeth before radiation therapy, but now we're looking at extracting some teeth that are infected before chemotherapy as well. So this is a developing science. I was just at a cancer seminar here that is sponsored by one of our local physicians, and have been talking with physicians about that. So it's important to get a dental examination at any critical time, and particularly, I'll just say this outright: if you're going to have a major medical change, if you're going to go through chemotherapy, get a full dental examination first, because I know you don't want to extract teeth, and we're not talking about extracting a lot of teeth, but it's dangerous for you to extract teeth or risky to extract teeth after chemotherapy, particularly some kinds of chemotherapy, and it is much more beneficial, and you have a better chance of getting complete healing if you do those extractions on a timely basis before the chemotherapy. So no matter what, get a full dental examination when you're making a medical change. It's full x-rays, full evaluation, full examination. Doesn't mean you're going to have major expenses in dental care. That's not the idea. The idea is to prevent you from having a significant oral infection after the chemotherapy.
Yeah, and really, as we go along, in just a few moments, listener, we're going to give you what I consider one of the greatest bargains in the dental world, which actually ends up being a help to us in helping seniors. So we're gonna talk about that in a minute too. I just wanted to basically have that moment to say it was fascinating to me, Dr. Lee Sheldon, that when I was going back through this universe of TV programs that Helping Seniors has organized now since Joe started the organization, how the wide variety. Yes, there's definitely topics about, getting a perfect smile and important things like that. But there's so many things that we've done also where we've talked about items that are really a whole lot deeper than you would kind of just think of on the surface. And I really think, listener, there's a great library of materials. And when you think about the fact that we're fortunate to have somebody with the caliber and reputation of Dr. Lee Sheldon, who's invested his time to share with us his expertise and knowledge. I know you participate in training for periodontists throughout the country. You're called out to lectures, and yet you're kind enough to spend time on the radio with us.
I'm just a ham.
Well, onward then.
Wait a minute. I'm saying I'm just a ham, and this is before the Jewish holiday of Passover, and I'm saying just a ham? Oh, my God!
Well, and he has a sense of humor, too, folks. So
I'll have to have an extra piece of matzah for that.
There you go. So what we're going to do today is we're going to start diving into today's topic, the formula to dental success. And the questions that people often would have, I think this way: how can I reduce my dental expenses? What are the keys? How am I being effective? And am I doing things that could ruin my teeth without even maybe necessarily doing that? I know when we were kids, we were told to stay away from sodas and stuff like that. So I'm sure that's on your list, right?
It is. I mean, we've got to look at it from a military standpoint. We've got the attackers and the defenders. Okay. And if there are too many attackers and not enough defenders, what happens to the place that's being defended? Collapses, we lose. We can repair really well. We're really good at that. But the things that cause you to need those repairs can overwhelm everything that we do. I just saw a patient just before I came upstairs to talk with you just now, who had some significant repairs done. Significant. And those repairs that we're doing are breaking down. So I talked with him. And by the way, we'd had this conversation before. So I talked with him and said, all right, your teeth are decaying. How much sugar are you eating? And he said, well, not much. I said, well, in 2017, you were drinking a lot of Gatorade. How's that? Well, I'm drinking less Gatorade now. I'm drinking about 20 ounces a week. But then I'm drinking lemonade too 40 ounces a week, and then lemonade too at 40 ounces per week. And I'm drinking another juice at about 64 ounces a week. And then I did the examination and talked about this sense of overwhelm, that you're overwhelming what our system can do. And they said, oh, by the way, I like chocolate too, and I ate a lot of chocolate. We can do great repairs. We can do a tremendous job in restoring function and restoring cosmetics in the mouth and really do something good, and you can ruin anything that we do.
Wow.
And that's what's going on right now. Now, of course, I was a little bit nicer about that, but I did talk about attackers and defenders, and right now, your attackers are overwhelming us to the point where when I'm asking a question, it's not, can we repair? Because often we can, or if we can't repair, we can do a dental implant. But the other question I'm asking before I make a recommendation to the patient is it worthwhile? Is it worth your spending the money with us to do it? Because if you're going to spend money on a crown and we see that crown or the tooth around the crown or under the crown decay as a result 3 or 4 years later, have you spent your money wisely? And so we've got to look at not just can we do it, but is it worthwhile? And the worthwhile has very much to do with a lot of the things that we consider to be commonplace right now. The first one, as I said, is sugar. Mm-hmm. Sugar is the biggest attacker we have, not just to the teeth, but to the rest of the body. Mm-hmm. If we're looking, the big thing in medical care right now is inflammation. We all hear inflammation, right? You've heard it.
Yeah.
Or what? Do you know what the primary thing that causes inflammation? Sugar.
Wow.
And so whether you're going to overwhelm your teeth or whether you're going to overwhelm your arthritis or your heart, sugar is a poison. And people are consuming way, 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 way too much sugar. In 1950, and I think I've got this data correct. If not, I'm close. In 1950, people were consuming somewhere on the order of 30 or 40 pounds of sugar per year. Now people are consuming over 170 pounds of sugar per year.
Wow.
So we're talking about disease. Oh, we've got to cure disease. Donate to this society, donate to this society, to control disease. For God's sake, 32 pounds of sugar versus 170 pounds of sugar? This is something that you can do to prevent every disease or help prevent every disease, not just dental disease. But yeah, in terms of if it weren't for sugar, I wouldn't be nearly as busy.
Well, as you're saying that, I'm thinking. So you go to the doctor's office and they yell at you about being overweight because we're eating too much sugar, and then you go to the dental office and they're concerned because we're having too much sugar. And I guess it's it's interesting because oftentimes you hear about it in terms of some downstream effects as we get older, maybe links to diabetes and things like that. But even as a kid, they were telling us you need to be careful with the sugar because of your teeth and things like that. But it's interesting how you break it down and make us remember that it's not just our mouth that's being impacted by the sugar. It's actually our whole body. And that's another thing. As I'm on this tear about all these great radio and TV shows, Dr. Sheldon, that you've done over the years. We've done shows where we've talked about how dental actually impacts your whole body too. And so it's interesting because you've always made that connection that everything is connected.
It is, and the connections are greater and greater and greater, and there's just so many procedures and so many drugs that we can use that is trying to take care of some of this overwhelm. But just think back. I mean, most of the people that are listening here are our age, or in their 60s, 70s, 80s, and so just think about when you went to the gas station when you were a kid. And it was a treat because you went to the gas station and every once in a while your father would give you a nickel or a dime or a quarter, depending how old you are, to get something out of the Coke machine. Today, we go to the gas station. Do we have any gas stations anymore? There might be a few. But most of these are gas and convenience store stations. And take a look at what the entire wall is lined with. Refrigerators with all the stuff that is going to destroy your teeth and is going to destroy your body.
Yeah, so I was thinking, it almost takes me back to Andy Griffith days in a bottle of pop or whatever. You're right. You're right when you say it like that. So as we're going to continue our conversation about the formula to dental success after the mid-show break, we've got several other factors that I know we're going to get into. We've got actually a list of 5 of them. We've covered sugar as the opener, and we've got more to come on the second half of Helping Seniors Radio. So one of the things that I wanted to mention, Dr. Sheldon, before we get to the break, is if somebody's hearing this, what's the best number to reach your office and say, hey, I hear you guys talking about stuff. I'm interested. I want to learn more. I want to schedule an appointment. And we're going to talk about the special offer in the second half of the show. It's a great fundraiser for Helping Seniors, but it's a great help for yourself too.
Thanks. The office phone number is 321-259-8000.
Yeah, and I'm not kidding. You can take a look at all these shows that we have online because we archive everything. We've archived the articles that Dr. Sheldon has done in our Helping Seniors newsletter. We've archived the TV shows. We've archived the radio shows. There is a plethora of information there, not only about the dental side of things, but just everything connected to being a senior. And so really want to encourage you to have a look at that. And also when we come back on the second half of the break, I'm going to reintroduce you to a good friend of ours in the Helping Seniors world. His name is Mark Pylock, and he is our real big benefactor because he opens up that muscle car museum for our Helping Seniors car raffle fundraiser. And he made the news today, and I'm going to be excited to share that with you as well as we get get to the second part of the show. So with that, let's go ahead and take our mid-show break, and stay tuned. We got more Helping Seniors straight ahead.
And that music means we're back for the second half of today's edition of Helping Seniors of Brevard. The program heard every Wednesday, 12 noon to 1 o'clock, right here on 90.3 FM, the home of the Information Overload Hour and Helping Seniors of Brevard. Let's get back to more of the show right now. Here's your host and the Executive Director of Helping Seniors of Brevard, Kerry Fink. Hey, Kerry.
Hey, John Harper, thanks, and welcome back to the second half of Helping Seniors Radio. This is the radio show from the nonprofit organization Helping Seniors of Brevard that our President Joe Steckler established back in 2011. He still is the chairman of the board, and we follow his leadership daily on all things helping seniors. You may know Joe. He's the guy that created the thing for Brevard Alzheimer's. He got those things they call the Joe's Clubs rolling. He retired from that, couldn't stay retired, so he started up Helping Seniors of Brevard, and here we are now going into our 12th year of service, providing the county senior information line at 321-473-7770, as well as our Helping Seniors information outreach, which this is part of it, every Wednesday, 12 noon on 90.3 FM WEJF, and also online at WEJF.net. And so we're having a great conversation with our longtime friend. He has been with Joe going back into the broader Alzheimer's days. He's a noted area periodontist. He's the guy, I like to call him, I don't know if you prefer grandfather, but maybe it's the father of implants. It's Dr. Lee Sheldon.
I prefer grandfather in certain contexts, but I'm not sure that's the one.
Okay. Well, all I'm trying to signify is that Dr. Sheldon has an amazing amount of experience to the point that literally practices around the country seek his advice and guidance. And he's been a friend of Helping Seniors since the day Joe opened the doors. And we're talking about the formula to dental success. And so we're going to jump right back into that. We already heard rule number one, which is we gotta stay away from sugar because that's a big challenge when it comes not only to your dental health but everything else. And we're going to get to the other four. Before we get there, I teased this as we went into the mid-show break. It's about a great friend and help to the work of Helping Seniors. We're talking about Mark Pylock, who's the gentleman who owns the American Muscle Car Museum. It's that fantastic private collection that he's got right there at 3500 Sarno Road. And ever since the day he opened that, we've had now five. This is going to be our fifth grand drawing there at his lovely American Muscle Car Museum for our Helping Seniors Car Raffle fundraiser. It's actually technically our sixth car raffle, but it's our fifth there just because he hadn't opened the museum yet the first year we did our fundraiser. But Mark Pylock is a great benefactor to our community. He's done the Pylock dog parks that you're familiar with. He made a lot of money in the pet business because of his expertise as a pharmacist and knowing how to do certain additives and things like that. But we know him and appreciate him for being just a great help to us in Helping Seniors, because he's been kind enough to open up the doors of the American Muscle Car Museum every year that he's been open for our grand drawing. And it's a big event, folks. Last year, we had 2,500 people out there enjoying a great night. Mark and his wife, they picked up the food. They just made us all feel like royalty out there. Touring his collection was unbelievable, $70-80 million worth of cars. And that's included when you get your Helping Seniors car raffle ticket. So you want to put this date down on your calendar, give you a moment to grab a pen and a paper so you can put this down. It's Saturday, October 29th. That's when the big party at Mark Pylock's American Muscle Car Museum happens. And also that night, somebody will get a brand new car. They'll pick their choice from AJ Hires, Boniface Hires dealerships. They could choose a brand new 2022 Camaro. They could take a 2022 Dodge Challenger. They could take a 2022 Kia Sportage, which is exactly what David Odahowski, our winner from last year's Helping Seniors car raffle, that's what he selected. Or you could take the spiffy little Mazda Miata convertible and look really cool tooling up and down A1A in that kind of a car. But it's going to be your choice when you win October 29th, Saturday, October 29th. So when you get your ticket to support the work of Helping Seniors, you do three things. Number one, you are in fact helping keep this organization go, because we can't do this without your help. If you do not support Helping Seniors, there is no Helping Seniors. And to date, we have helped more than 4,500 families free of charge through the Senior Information Helpline, and we've literally reached hundreds of thousands of seniors and their families through our media outreach efforts. And then if you know anything about Joe, he's the toughest advocator for seniors every place. You've been seeing his columns recently in Hometown News. He's been on this topic of affordable housing crisis for seniors here in Brevard County. And so that's what we do as a charity, and how you get involved when you buy that ticket, 1 for $25 or 5 for $100 donation to Helping Seniors. You're actually supporting the work of Helping Seniors, ensuring that we're able to continue forward. But number two, you have a shot at picking up one of those 4 cars. And number three, while you don't have to be present to win, it is such a great evening at the museum. You get 1 ticket for $25 or 5 for $100. Just being in that museum is worth the price of admission alone. But the real reason I wanted to talk about that for a minute, Dr. Sheldon, was because there's a news article this morning in Florida Today.
I read it. I mean, go ahead, Kerry. This is fantastic.
Yeah. So Jim, I was going to say, Jim Votro, our producer, who labors tirelessly behind the scenes on all this, he made me aware of it. But yes, so our very own Mark Pylock donated one of his Corvettes, or actually, I think it's 2 Corvettes if I'm saying it right. His donation helps raise $1.76 million for the Ukraine relief effort at the Barrett-Jackson auction. And the article in today's Florida Today goes on and talks about that Tetiana, his wife, worries about the safety of her relatives and friends under Russian bombardment, because she's originally from her native city is Kharkiv, the second largest city there in Ukraine. So what a generous effort once again from Mark Pylock to step in and really support and do something that's just amazing. And I know he's been a real super help to us along the way, Dr. Sheldon. And it says here that he apparently gave a couple of cars so that it helped generate a total sum of at least $1.76 million for Ukrainian relief via Samaritan's Purse. And Mark Pylock said, when I saw this is a quote in the paper, when I saw $1 million on the auction block, I was totally shocked, he said. All the add-on donations were equally shocking. But thank you, Mark Pylock, for all you do for Helping Seniors, but also what a great gesture. What an amazing step.
Absolutely. And of course, he supports charities all over Brevard County. So, a special person who's been very fortunate in life, and he earned his fortune. There's no question about it. But what an example of giving back.
Yeah. So again, just to bring it full circle, help us and help yourself. Come out and check Mark's amazing collection on the it's going to be the 29th of October. But you can get your tickets today. You can get them either by calling Nancy Deerdorf at our Senior Information Helpline, 321-473-7770, or you can also get them online at HelpingSeniorsCarRaffle.com. That should be easy enough to remember, HelpingSeniorsCarRaffle.com. And actually, Dr. Sheldon, you're supposed to have tickets at your office, so people can go by your office and pick them up, too.
They can. I don't know if they've arrived yet, so we'll have to check with Nancy on that and make sure I have them.
We'll make sure it happens, but you've always been kind to be a pickup point on that. So,
yes.
So kind of that as background. Let's jump straight back into this. We were talking about the formula to dental success, because most of us are vitally concerned with how do we reduce our expenses for dental and dental related things, and what are the keys? How can we do this well? And so the first thing we talked about in the first half of the show was the challenge with sugar, but there's a few others we want to cover here. One of which you mentioned was medications, which I thought was surprising.
Yeah, medications. Most medications cause dry mouth. By the way, if you eat less sugar, you may need fewer medications. So, just a hint, I'm not a physician and I'm not giving medical advice, okay? But just a little hint. Yeah, so most medications cause dry mouth. When your mouth is dry, it is acidic. In other words, it's full of acid. Acids dissolve tooth enamel. And dissolved tooth enamel means tooth decay. And so if you can reduce the number of medications, you potentially have a lower chance. But on our patients who are on medications, we're asking them to be on baking soda rinses on a regular basis, because baking soda rinses will take an acidic mouth and make it into an alkaline mouth. Now, how long will the baking soda rinse last? It'll last probably for most people 3 to 4 hours before it goes down to acidic again. And so, you keep a flask of a couple tablespoons of baking soda in, let's say, a tablespoon of baking soda in a flask, let's say a 1 pint flask, and you just keep that. That's your hip flask, and you rinse out every 3 hours with baking soda rinse in order to be able to neutralize the effects of dry mouth. Now, that's not the only thing that's done, but that's a common and cheap, or at least in our office, it's common and cheap way of going to neutralize acids.
It's interesting because, you make the point about medications being a challenge, and then the very next point that you make on this is about illegal drugs. And I love the way you put this. If you see your teeth dissolving as a result of something that you shouldn't be doing, you're about to get into dentures.
Wow. Yeah, it's absolutely true, because if we're looking at somebody, for example, crystal meth, probably in our group, maybe not too many people have it, but crystal meth will dissolve teeth. It's people have totally black teeth all over. They that we call that meth mouth. That is common in the dental profession. But you know what? I don't want to jeopardize our nonprofit or profit or any status, nor do I want to be in some way censored by saying what I'm about to say. But there are certain carbonated beverages which, if you drink them frequently enough, you'll look like you have meth mouth.
Oh, no.
Yeah.
Oh, no. Mm-hmm. Wow. Well, does that go back to the sugar, or is it past that? Because what if we're drinking diet versions of those beverages?
I don't know. I can't tell you about diet versions of those beverages. They're probably sugar, but there's certain beverages. There are a lot of different beverages, but there's a certain beverage that happens to have a bit of a lemony flavor that seems to dissolve teeth more than anything else.
Wow. How about that? Who would know these things? But I guess you see it. You see it every day in the dental chairs. As
I do. Hopefully, I don't see it every day because it's awfully depressing. But those are the people who we can't do anything for. And frankly, if you look at the two diseases, and we've talked about this in other shows, and I'm getting off the subject a little bit. But if we're looking at the two diseases, periodontal disease and tooth decay, periodontal disease is a lot easier to control than tooth decay.
Right.
In other words, that periodontal disease, we can often save your teeth. Tooth decay, rampant decay, it's all over the teeth. No, that's the type of tooth where often we'll repair the teeth and they'll decay again. And so the rampant tooth decay, we see tooth decay all over the place. That's the more likely person where I'm going to recommend extraction and dental implants.
Well, and that actually kind of leads us to the fourth point, right? Because we've talked about sugar, medications, illegal drugs, and then your fourth point makes sense because every time we go to the dentist, we're usually told we need to brush better, and you literally call it bad oral hygiene is a big factor.
Yeah, no. In the first segment, we talked about that patient that I just saw. Okay, so he's eating a lot of sugar. We're talking about the juices and all the things, juices and Gatorade and all this. I guess I just mentioned a brand name.
Yeah,
John, are they going to take us off the air now? What do you think? So, if somebody has bad oral hygiene, that means there's lots of bacteria that's overwhelming the immune system. Okay, so you got the attackers and the defenders. The attackers are the bacteria. The defenders is the immune system. The bacteria, meaning the plaque, can overwhelm the immune system. And so, example of this patient who had some dental implants done, and some of the dental implants are failing. And what do I see around the teeth? Gobs and gobs of plaque. Well, we can always repair a problem, but is it worthwhile? Is it worth the expense to repair a problem around a dental implant? Only if your bacteria control is going to be good. And so the answer to that person is, all right, I want you to demonstrate to me over a 6-month period of time that you can keep these teeth 100% plaque free, which is not that difficult. Over a 6-month period of time, if you can, then maybe it's worthwhile for us to go back and repair some of these dental implants that have lost some bone support. But that's what happens. That's what happens.
Well, so clearly, like as we're talking about these different factors, right, the things we want to think through, our use of sugar, medication, staying away from illegal drugs, bad oral hygiene. And the fifth one, I guess we're often guilty of that because, to be honest, I guess we just want to put off going to the dentist. But you call it avoiding dental care.
Yeah, avoiding dental care is a problem. Understand that in my practice arena, I was, of course, I'm a specialist. I'm a periodontist, and in our periodontal practice, we had patients who were referred to us, and we would do the work that we need to do in order to be able to take care of the gum disease, do the dental implants, whatever that is, and then refer the patient back to the general dentist for treatment. When we started becoming a full service practice, and we had patients coming to us directly, the first thing that I saw, which I hadn't seen as a specialty practice, is how many patients have been away from the dentist for 5, 10, 15, 20 years or longer, and we're looking for a way to get back in and perhaps the right person to look at them, whatever that was. I was amazed at the number of people who've stayed away from dental care, and the primary reason they stayed away from dental care was because of the bad experience that they had as a child. And that is more common than of course I'd heard of it, but it was more common than I ever believed. Our whole demeanor in dentistry, and I'm not just talking about our practice, I'm talking about in dentistry, is to our whole goal is to change that mindset, that dentistry can be a good experience, not just with the medications that we give, putting people to sleep. Yeah, I know we can make any good experience good by putting them to sleep, but having a good experience, a comfortable experience in the dental chair where you're listened to, where we respond to what you tell us, we don't order you around, and we work together in order to be able to accomplish a result. One of the most, there are a lot of satisfying things that have occurred to me in my career, but one of the most satisfying things, Kerry, is when I see a patient who's scared to death of me, first visit, and the patient comes in and he or she is sweating, and it's that nervous laugh and that type of thing, and we talk about sedation because usually when they're coming to see us, they have major problems, and so we'll do some sedation in order to be able to get them past that. But then when I see them a few years later and they're walking in without any sedation at all, with a smile on their faces to get their teeth cleaned or to get a filling done or to get something done, and they come in without any fear, that's when I know we've accomplished something.
Well, yeah, and not only that, to me it seems like this. First of all, your office staff is just very welcoming. They make everybody feel comfortable, and they make everybody kind of feel relaxed. And I remember we had talked about this on a past radio show where you said one of the feedback, when people leave you like Google reviews or things like that, and one of the comments that you said was really meaningful for you was somebody had put no pressure, because they had felt really good that they could come in and have the conversation information about what was going on with their situation without maybe A, being judged, and then B, maybe being tormented into something that may not immediately make sense for them to be able to do, but that you really just laid it out and helped them, guide them from the point where they were coming in at.
Yeah, it's true. I mean, we want to get past the idea of being judged or being sold or whatever that is. I mean, you know, and our listeners know, those people who have listened to us for a while have read, I mean, we do major dental work, and certainly major dental work is not cheap. But just because you walk in here doesn't mean you automatically have to have major dental work done, and you don't have to have major expenses. You just don't. It's a matter of getting to the dentist, exercising some of the habits that we're talking about, reduce the amount of sugar. Let's make sure, you know, medications, do you really need them or not? And work with your doctor on getting off medications. It's very easy to get on medications, but it's more difficult to get off medications. But sometimes you can. And then we talked about illegal drugs and bad oral hygiene, and then avoiding dental care. You know, the idea is to come into an office, establish a relationship with the dentist that's there, and I'm not saying just our office. I'm not advertising me. It's establishing a relationship, be comfortable, and have an open line of communication where everybody has the right to say no to anything that occurs without you being judged. You know, you've got that, then you've got a great dentist. You've got a great opportunity, and frankly, you have a better opportunity to spend less money on dental care rather than more.
Right. So let me ask you this, because one of the things I did want to make sure that at least brought into the conversation, because it is a help to us. We were talking earlier about Helping Seniors of Brevard being a nonprofit, and we the only reason we can do what we do is through the generous support of individuals who do things like buy the car raffle tickets and help us that way, or they're part of our annual giving fund, or they're businesses that care about seniors and they get involved in the business partner aspect of being connected with helping seniors. But you've come up with a very creative way that benefits somebody that wants to figure out where they are dentally, but that also helps us as a charity. We're one of the charities that you guys have available to support, and I think you call it Solid Bite Gives Back or something like that?
Solid Bite Gives Back, yes.
Good.
And so Solid Bite Gives Back is essentially write a check for $50 to Helping Seniors of Brevard, and you'll get the complete examination, dental CT scan, dental x-rays, a 2-hour experience in our office at no charge. And of course, if you want to write a check for more than $50 to Helping Seniors of Brevard, we'll take it.
Yeah. Well, and we appreciate it. And so the thing that's wonderful about that, because I remember, well, first of all, it's a blessing to us as a charity, because it really helps us continue the work of helping seniors. But the reality is it's a blessing to yourself, right? Because I remember we've done programs about why you feel it's so important to take time with a new patient to really get all the tools that you need to make the best organized approach or plan, I guess a dental plan, as to how to keep everything going and everything safe and everything correct in the mouth. You need all those things. You need the CT scans, you need the x-rays, or all the different things that would be part of that, right?
I can't get along without a CT scan. I find so much pathology, and I'm talking about bone infections with the CT scan. It's probably the most important piece of technology, dental technology, that we have right now. And you're seeing more and more CT scans in dental offices. It will be standard of care, and I don't think it'll be too long, because you can't see on x-rays what you can see on a CT scan. X-rays are good to determine cavities and perhaps some bone levels on teeth, but they're not very good for diagnosing infections, particularly root canal infections in the mouth. So the experience, frankly, it's my staff that creates the experience. I walk in, or Matthew or Michelle walk in and do our examinations, but it's the staff and the training our staff has, and the knowledge and the compassion our staff has, that really makes the difference. And so, it'll be a 2-hour experience, whether you think you need a cleaning or whether you need extractions of Solid Bite. It is a 2-hour experience, because I want to make sure that we're not missing anything, This is one opportunity where a person has a chance of doing a complete look at the mouth and making sure that we've gone over everything in detail. And nothing pleases me more than I can say, we've gone through everything completely. You don't need anything. We'll set you up for cleaning, whatever you'd like.
No, that's great. And, I was thinking it's one of Nancy Deerdorf, our operation director's favorite sayings. She says, how do you know what you don't know? And so the other thing she says is corollary to that is knowledge is power. And so what we're really talking about is if you have an opportunity to sit down and get a real understanding of where you are, that is part of the formula to dental success, I would think. If somebody wanted to call the office and just get some information about how all this works, how do they reach you?
Just give the office a call at 321-259-8000. And by the way, that book, we talked about the book, The Ultimate Mouth Manual, call us for that too. We'll give you a link and you can download it yourself. You can read it at home and see and get some more information about potential problems in your own mouth.
Yeah, that's an excellent point just right there is that Ultimate Mouth Manual. That's the book that you wrote that's now in its 3rd edition going to 4th edition. Really is a great, very easy to read, very easy to understand, at least for a consumer's point of view, a non-technical treatment, but it gives you some background and some insight into what's going on. So I think it's really worth just checking that out and definitely help us on the helping senior side too. So that's where we are on this show. Thank you, Dr. Sheldon, for joining us. We'll be right back here next Wednesday on 90.3 FM WEJF. We'll see you then.